Hello! Thank you for joining us for our Web Wizard for Home and Community-Based Service Provider Self-Led webinar. Just a quick disclaimer, this presentation is a general summary that explains certain aspects of the program, but it is not a legal document. All information was accurate at time of publication. The Multiple Claim Submission Wizard was designed to be used by home and community-based service providers that are billing for services such as adaptive equipment, adult day habilitation, community transition services, consultation services, clinic visits or encounters, crisis intervention, environmental modification, personal care services, respite care, supportive employment, and supportive living. To access the Web Wizard, you'll go through our secure provider portal at arkansastotalcare.com. Click on the For Providers tab and you'll see the Login button. If you have not already registered for our secure provider portal, you'll need to click on the Create an Account button on that login page and follow the steps to register. Once you are logged in to the Secure Provider Portal, on the dashboard at the very top, you'll see a tab that says Claims. That's where you will click to access the Web Wizard. But while you're on the dashboard, you can also view things like patient eligibility, authorizations, or send a secure message. Once you click on that Claims tab, it'll take you to a page that shows you your individual, saved, submitted, and recurring. You want to click on that Recurring tab to get to the Web Wizard. Once you are on the Recurring tab, the first step will be selecting a template by clicking the drop-down in the field next to Claim Type. The example shown on the screen is for a HCFA 1500, and so for this presentation, we will choose Respite Care. If you are providing services for personal care, the code T1019 is already selected. The next step is to select the service location. One provider may have several different locations listed, so you will need to verify the correct MPI, provider Medicaid number, and address when selecting a service location. If the correct location does not appear, you will need to contact the health plan. The next step is to view your member list. Member lists are created once using the Member Arkansas Total Care ID or last name and date of birth. The member list is only created during your first time using the Multiple Claim Submission Wizard. To add a member, click on the Add Member button and enter in their ID or last name and date of birth. You will then see a message letting you know that the member has been added. Their name and ID number should appear in the column below that member name and ID in your member list. At this time, you can either add another member by going back up to the Add box or move on to create a claim for the new member. Once your list has been created, if you need to remove a member, it can be done by clicking on the green X in the Action column. Please note that the member record is listed in alphabetical order by last name. If you are unable to locate a member, check the member ID and date of birth to make sure it was entered correctly. If it is still not found, please return to check eligibility and verify that that member is still eligible with Arkansas Total Care. Now that your member list has been updated, you can create a claim. All fields marked with an asterisk must be completed. You'll begin by selecting the appropriate member, or if it's for all members, click Select All. For each member selected, you can add modifiers if needed, and you're able to enter up to 4 modifiers per member. They must be separated by commas. The date of service start will be the first date of service, and the date of service end will be the last date of service. Put in the total charges billed and the number of days or units. Then click on Update All once the service lines are updated to create that claim. Your next step will be to review your claim and edits, and you can also make changes at this point by clicking on the Edit Review button under the Action column. You want to make sure you closely review the procedure codes and modifiers that are about to be billed for accuracy. Some fields may not allow you to edit them. If those fields need to be changed, you will need to delete that claim and start over. You can click on the X to delete that claim. Once you have reviewed the claim, if all the information is correct, you can close that screen and go back to submit the claim. Or if needed, you can edit the existing service line or add a new service line to your claim. And once you have completed that step, click the Close button. If you did need to edit the service lines, you can modify the place of service, procedure code, amount, days or units, and additional modifiers as necessary. Once you have completed editing that information, click the green Save button. You can add up to 4 additional lines for a total of 5 lines per claim. If you want to change any of the pre-coded fields, you should select Edit after you've added your new service line. Once you've completed the review and made sure that all the necessary edits are completed, check the certification box and click Submit Claim. Success! Your claim has been submitted. You can click on Print to print a copy of the claim submitted, including the web reference number. You can also click on Submit More Claims to return to the claim screen to request a new template or to move on to other functions. If you need to contact us, your first point of contact should always be the Provider Service Call Center. That number is 866-282-6280, and the Provider Service representatives can assist you with questions regarding eligibility, authorizations, claims, payments, neg valves. Representatives are available Monday through Friday, 8 a.m. to 5 p.m. Central Standard Time. After speaking with a provider service representative, you will receive a reference number which will be used to track the status of your inquiry. If you need to escalate to your assigned provider relations representative, you will need to have that reference number as well as the provider name, tax ID, NPI, a summary of the issue, and any applicable claim numbers. If you have an education request for you or your staff, please submit that request to providers@arkansas.totalcare.com and include the clinic information, NPI, tax ID, and a summary of the issues that you would like training on. If you have not already, sign up today to join our provider email list. It's a great way to stay up to date with any changes for Arkansas Total Care, as well as upcoming webinars and presentation events. Thank you so much for joining us today for this self-led webinar. We hope that it was useful and helpful. Please reach out if you have any questions and join us for any of our upcoming live sessions. Thank you.